Hello, and welcome to Healthcare Matters, where thought leaders come to discuss the intersection of medicine and the law. I'm your host, Mike Matre, and today's guest is Dr. Jonathan Terry. Dr. Terry is a board-certified osteopathic physician and surgeon, as well as a general psychiatrist. Welcome to Healthcare Matters, Dr. Terry.
Thanks so much, Mike. I really appreciate the invitation to be on the show.
So you were talking about an electronic informed consent form. And I assume that would be filed away in the electronic medical record. How do best practices for entering data into a medical record when it's acquired via telemedicine as opposed to face-to-face encounter differ?
You know, documentation with telemedicine, even though in some ways we're taking shortcuts along distance, that sort of thing, documentation is certainly something we can't take any shortcuts with. And so best practices for telemedicine include documenting not only that the practice occurred, of course, by telemedicine, but also in many sort of third-party payer situations, why was telemedicine used? Commonly, this might be because of no local provider being available. Today, if you want the service, this is the way we're offering it. It's also a good idea to document each encounter, of course, that the patient has renewed essentially their informed consent to telemedicine, and that the provider or staff have explained the risks and limitations of the process of telemedicine itself. Many medical records, of course, now allow for electronic submission of our charges, of our ICD-10 diagnoses and CPT codes, and there may be additional procedure codes as well that should be documented and entered at both the origination, usually where the patient is at, and the receiving, where the provider is at sites.
Thank you for your time, Dr. Terry.
My pleasure, Mike. Thanks so much for having me on board.
One of the greatest challenges in rural communities is access to health care. What advantages does telemedicine offer in treating these underserved populations in the United States? Also, Texas, one of the largest states in the country and one of the largest rural communities, recently made it more difficult to practice telemedicine. They no longer allow a doctor-patient relationship unless the patient and doctor meet face-to-face initially. How do you feel about that sort of regulation?